What's up, everybody? Matty Willz checking back in for another episode of our brand new, I guess it's not a brand new feature anymore, for our feature, Wellbeing Wednesdays with Matty Willz. I'm Matty Willz. Of course, this is brought to you by MetroHealth. And today we're talking to another expert in her field. She comes with, as usual, a long list of accolades and all types of expertise. So I'll let her kind of run through that. But let's bring in Dr. Ajasha Long from MetroHealth. And there she is right there. How you doing today?
Hello, everyone.
So first and foremost, I say this to all of you. It's so important what you guys do. We appreciate so much of you just taking time out of your busy schedules, your busy days to come and chop it with us for a little bit. And everything that we talk about is very valuable information for the community, which of course is what we're going to do again today. So I know today's episode is the third episode already, which is crazy, but it's behavioral health in the prison system. So we're going to get into that in just a little bit. But before we do that, why don't you let the good people watching and listening to us right now, just let them know a little bit about you and what you've gone through and what you're all about.
So as mentioned previously, my name is Dr. Ajasha Long. I am a licensed psychologist in the state of Ohio. I currently work for MetroHealth Medical Center. I am stationed actually at the Cuyahoga County Correction Center. So that means that I operate as a correctional psychologist where I provide mental health treatment for persons who are incarcerated. I received my bachelor's degree from Alcorn State University in Norman, Mississippi, and a master's degree from Alabama A&M University. So I'm an HBCU graduate, and my PhD is from Ball State University, located in Muncie, Indiana.
So as always, as usual, par for the course, you guys have all gone to school a lot longer than I have, or probably a lot of people that I work with. So that's why we lean on y'all, because y'all know what you know exactly what you're talking about. So as we shift into today's conversation, just talking about, behavioral health in the prison system, let's just start with the basic question of why is this important to MetroHealth, and more specifically, why is this important to you?
So there's several aspects of this question. First, there's a practical aspect, and then there's also a humanity aspect of it. So when we think about MetroHealth, when you think about the mission of MetroHealth, we're an organization that prides itself on being a catalyst for change in our community. So in our health, in our communities, in the world in general, we typically go and serve the communities that are most fragile. So for as long as I've been with Metro, I've known us to serve and go in places that other people aren't necessarily willing to go. And so the jail is no different. When you say that you are about population health, community health, you can't really say that that's your thing if you exclude incarcerated persons, because however we look at it, those people are still a part of our community. So it just made perfect sense given Metro's missions. Now, my personal mission, I've known since I was in high school that I wanted to be a psychologist. So pretty much for a long time, I had no idea how long it was going to take, but I always knew that I wanted to intervene in my community, specifically for people that looked like me. Now, again, I never imagined that it would be in this way, but this is the perfect way. Why not start with those who pretty much have been marginalized from the community, that have kind of been pushed out for whatever reason, whether they're guilty or not guilty. These people are still deserving of healthcare. And, really the reality of it is most persons who are incarcerated will re-enter society. So when you think from a practical standpoint, would you rather a person become incarcerated and get treatment and get access to classes and different interventions and things of that nature and then re-enter the community? Or would you rather them just kind of go to jail and prison and then come back without any type of training, any type of intervention?
Such a good answer. And it touched on a couple of things that don't normally come to mind, at least for myself. I know, when we think about people who are incarcerated, it's easy to kind of just think like, wow, it'll be quite some time or maybe never before I see that person again. So for you to step in and say, and not only recognize, hey, statistically speaking, whatever those numbers are, most of these people are going to return back to regular society. It makes perfect sense to get them the help that they need while they're undergoing that situation. And then the other thing that you said that I thought was dope was, for whatever reason in this country, we know the type of person, we know the race of the person that's normally incarcerated. So when we are talking about helping Black and brown people, that is a great place to start. So thank you for that answer. So in your experience, what are some of the more common mental health issues that you do come across with people who are incarcerated?
So one thing that comes to mind specifically, we see a ton of trauma. So when you think about any type of psychological trauma, past history of abuse, whether that be physical, mental, sexual, psychological, substance abuse. So a ton of trauma, a ton of PTSD and things of that nature, depression, anxiety. Typically, many of the same problems that you're going to see at any outpatient behavioral health setting. But the trauma piece is one that probably, if I saw 10 people who were incarcerated, probably 9 out of 10 of those persons would have had dealt with some type of traumatic experience in their life.
Wow. I didn't mean to cut you off. No, go ahead.
I was just going to say, and I think it's important to note that a lot of times these traumatic experiences are a catalyst for people being incarcerated in the first place. And so in our work, especially in the mental health field, we go in not so much of what have you done, right? But why did you do it? Really trying to get to the root of the issue.
Wow. Yeah. And, it was something else that you said in the first answer. They might not be guilty. So that could be a whole different kind of trauma-inducing experience in itself. Yes. So I'm sure you come across, wow, God bless you, man. I'm sure you come across all types of stories and just different personalities and the whole nine. So what do, just moving the conversation forward, they're already in jail. So what do the treatments look like?
So we have a plethora of different treatments that we offer. One thing is, we have individual and group therapy. So it's interesting because for a lot of people, they were not seeing a mental health professional, a doctor or a social worker or anybody like that before they came to jail. So a lot of times it takes people coming into a place like that to get stable. They may have never had any of these services. And now all of a sudden, they're getting mental health treatment. They're getting medication management. They're going to the dentist. They're getting all these services to help stabilize them for reentry. So we offer, from a mental health standpoint, we offer individual therapy. We offer group therapy. We have some amazing, amazing social workers, amazing clinical social workers that are doing really, really great work. Another piece is that we offer, we have an addiction medicine department. So those people that are struggling with substance use concerns, or let's say you may come into the jail and you're withdrawing from a substance, you can get help from the minute that you walk in the door. The intervention starts. So we can kind of set you up with different types of programming and things to really help you on your journey. We have some amazing, amazing programming going on right now with our pregnant women as well, where women who are with child and are incarcerated are receiving services, not just, for them, but for their babies and things of that nature. So we have a lot going on. And also, with the new behavioral health hospital that's being built, this creates a natural pipeline for people that are released from jail who might need more care to be able to have a place to go that's still within the MetroHealth system. So this new hospital is really going to help us to kind of facilitate continuity of care, because before we may have referred them to different places in the community, but now we can send them to a place that's within our system so that they can continue the work in the behavioral health treatment that they started when they were incarcerated.
Dope. And of course, that new behavioral health center coming to Cleveland Heights. I like to remind folks, I am a Cleveland Heights High School graduate, and we will be out on actually there in a few weeks. So
Yes.
Listeners, viewers, make sure you keep an eye out on this feature for that as we go and kind of explore firsthand exactly what that will be. So, we all, or most people, know somebody or has a family member or a friend who's unfortunately had to go do some time. What advice would you give to those people in order to help those, formerly incarcerated people who have to reintegrate back into regular society? What can friends and family do to help those people?
So one thing I would say is to provide structure, but to encourage independence. So one thing we have to keep in mind for people that are coming out of the system is that being in jail or prison within itself can be a traumatic experience. So you don't know what somebody has gone through when they've done time. So providing structure, so sitting down, talking with them, providing a clear reentry plan. So things like sometimes people need support with even getting like driver's licenses, birth certificates, things of that nature. If you're coming out of prison or jail and you've been there for a long time, you might not have hygiene items. You may not have socks, undergarments, things of that nature. Having a place to stay, all of the things that would make someone feel comfortable. It's almost like you're starting life anew. So people are gonna need support, but also you want to leave enough wiggle room to where they can have some independence as well. So provide structure, but encourage independence.
For sure. Providing that structure definitely is key. But I think, to further that point, encouraging independence, super key, right? I mean, you don't want to, speaking for myself, I wouldn't want to put myself into a position where I felt like I was, going to be forced to take care of this person per se, but encouraging that independence, helping them get back out there into the world, definitely good advice. So for our viewers who are watching this, maybe they don't have a friend or family member who is in that position, but they still want to help. One, can they help people that are still incarcerated, and how would they do that?
So I think that's a very layered question, because of course there are different organizations and things of that nature that you could donate to if you're looking to help monetarily. But I think also from a societal standpoint, one way that we can help is to continue to debunk some of the stigmas around incarceration, because that's what makes it more difficult for people to re-enter society successfully. Again, as I stated before, if you're a person who's coming out of jail or coming out of prison, it's almost like you're starting from scratch. Sometimes, depending upon your record, it's more difficult to get jobs. It's more difficult to secure housing. So you have all these barriers, and some of those barriers are in place because of the societal stigma around persons who are incarcerated, and also around mental health treatment in general. Because we know that pretty much, I know for our jail system, about 65% of the people in the jail are being seen by a mental health professional, meaning that they're struggling with some type of mental health concern.
So, and before we get to our last question, I just want to remind everybody watching this, if this information is touching your heart in any way, please feel free to share it, pass it along, share the video, direct message it to whoever you think needs to see it, or just save it so you can watch it again later on. Because as always, what we're trying to do is really just get our experts' words out there into the public so that everybody has access to them. That's the point. So Dr. Long, thank you so much. We'll get you out of here with this one. Of course, if there's anything that you want to touch on before we officially wrap, please feel free. But and I think we touched on this a little bit, but we can dive into it. Does MetroHealth provide an outpatient plan for these patients?
Yes, absolutely. So we have what we call care coordinators and patient navigators. So when patients are preparing for reentry, so they're getting out of jail, there is a process that they go through to set them up with a clear reentry plan. So that means that they will be set up with behavioral health appointments. Each of our patients leaves with a 30-day supply of medications. So, because that a lot of times is a problem. Sometimes people come to jail and they get stable only to have that continuity break because they don't have enough medication or enough services to last them until they can connect. So not only do we connect, but we also give people things to last them in the meantime, which is super, super helpful. And again, now that we have this new behavioral health hospital opening, this is going to give us another clear pipeline to people who might be needing more in-depth services. So our group therapy that we offer at the jail currently is really going to mirror the PHP and IOP programs that we're going to be having at the new behavioral health hospital.
Dope. And again, that new behavioral health hospital will be opening in Cleveland Heights a few weeks out, right? Early October, is that right?
Yes, yes, yes.
Got you. So I'll meet you in person and everybody else that we spoke with over at MetroHealth. Dr. Long, you've been perfect, phenomenal, just like all of you have been. We appreciate you guys so much. And yeah, again, if this information touched you in any way, pass it along, share it with whoever you need to share with, and make sure you stay tuned to our channel because we'll be taking a firsthand look at that new behavioral health center in just a couple of weeks. So Dr. Long, did you have any more words of wisdom to share with us?
So I would just say, just kind of one thing. I know that sometimes for some people, they can't imagine themselves, being in jail or being incarcerated. But when it comes to the stigma, we really have to understand that some of us could just be one mistake away from being in a similar position to some of the patients I see and some of the patients that I serve. So really wanting to put that in perspective, that sometimes people are in these positions because of trauma, because of mental health problems. And it's not to provide an excuse or anything of that nature, but I think it would really help the overall stigma if we can really kind of start to put ourselves in other people's shoes sometimes.
Perfectly said, for sure. Great information as always. Thank you again, Dr. Long. We'll be meeting in person in a few weeks. Thanks to everybody for watching and of course, listening to the stations. And we'll be back soon. So it's another perfect episode of Wellbeing Wednesdays. We'll see you soon.